Hello, everybody. What is up? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani, and this is episode 106. On today's episode, I wanted to talk about how women can reduce their sleep apnea risk by just sitting less and sleeping better. Can this even help? So, sedentary lifestyles, unfortunately, have become the norm, right? We are all working at computers, working indoors, mostly working sitting down, either at desks or on the couch when we're home. And many people just don't get up and move around nearly as much as often as we need to. However, a sedentary lifestyle can negatively impact your health in many, many ways. It is linked to an increased risk of obesity, heart disease, type 2 diabetes, and also certain types of cancers. Sitting for long periods can also lead to muscle stiffness, back pain, and poor posture, especially if we're ones that slouch when we're sitting. And there's emerging research that suggests that a sedentary lifestyle may have implications for sleep health as well, especially among women. Sedentary behavior may increase a woman's risk for sleep apnea. Isn't that wild? Now, sleep apnea is a serious sleep disorder. We've talked about this. That is characterized by pauses in breathing. That's when a person stops breathing for 10 seconds or longer. And this happens multiple times throughout the night. And it has been shown linked to a range of health issues: daytime fatigue, high blood pressure, greater risk for cardiac issues, and even Alzheimer's and dementia. Now, while sleep apnea is more commonly diagnosed in men, research shows that sedentary behavior may increase a woman's risk of sleep apnea. There was a recent study that showed that people who sat for more than 8 hours a day, or people who sit for more than 8 hours a day, are at a higher risk for obstructive sleep apnea. And the study that was done at the university in China, the Zuni Medical University in China, showed that this association is more pronounced in women. Prolonged sitting can lead to obesity and fluid retention in the lower extremities. Both of these are risk factors for obstructive sleep apnea. And according to the Sleep Foundation, a 10% weight gain has been linked to a six-fold increase in a person's risk for obstructive sleep apnea. And because of this connection between OSA and obesity, the researchers investigated this relationship between sedentary behavior and OSA. So what they did in this study is they included 20,000, just over 20,000 participants who were aged 18 or older. Almost 51% of these were women. And OSA was assessed using 3 questions in the National Health and Nutrition Examination Survey, NHANES questionnaire. The sedentary behavior was assessed using a physical activity questionnaire and categorized it into 4 levels. People that had physical activity for less than 4 hours a day, 4 to less than 6 hours, 6 to 8 hours, and then more than 8 hours a day. And then it was adjusted for various factors. And researchers found that participants who sat for more than 8 hours a day had a higher risk of OSA as compared to those that sat for less than 4 hours a day. And also, those that sat for 6 to 8 hours a day had a higher risk for OSA. And a stratified analysis was done that showed that sedentary behavior was not significantly associated with OSA in men, but it was in women. Also, older participants had a stronger link between sedentary behavior and OSA. So the researchers noticed limitations, including self-reported symptoms and the study's cross-sectional nature, which cannot prove causality. So, of course, further studies are needed to explore these mechanisms. But then the question arises, how how can we as women reduce our risk for sleep apnea? And some effective ways to reduce risk of sleep apnea that's caused by sedentary behavior is make sure you're incorporating enough regular physical activity. Engaging in regular physical activity helps maintain a healthy weight, right? And we know that weight is directly linked with our chances of OSA. It strengthens the muscles of the throat. Super important to remember that. Activities such as walking or jogging, swimming, yoga, they can all be beneficial. Choose what it is that you enjoy doing. You may be one that may enjoy swimming, whereas another person may enjoy biking or running. Pick an activity that is not going to be a chore and aim for at least 30 minutes of moderate exercise most days of the week. Also, specific exercises that target the muscles of the throat can reduce the severity of sleep apnea. So, singing, if you are one that enjoys it, we don't necessarily have to be good at it, right? Singing, playing wind instrument, or even doing throat exercises that may be recommended by a speech therapist or even a sleep therapist, a specialist, can be beneficial. Then maintaining a healthy weight is key. Excess weight, especially around the neck, can increase the risk of sleep apnea. Remember, we've talked about all of that weight, all those muscles collapsing relaxing when we fall asleep, and any excess tissue that we have just collapsing into the airway, contributing to chances of OSA. Eating a balanced diet, portion control can help manage weight. Eating foods that are found in nature versus processed foods is also plays a huge role in helping us manage and maintain healthy weights. Consulting with your healthcare provider or your nutritionist can also provide personalized guidance for your particular situation. Another key one is to avoid smoking and limit alcohol consumption. Smoking, we know, can increase inflammation as well as fluid retention in the upper airway, and this can worsen your sleep apnea symptoms. Similarly, alcohol relaxes the muscles of the throat, increasing the risk of airway obstruction during sleep. So quitting smoking and limiting alcohol intake can help reduce these risks. Remember, the key is, if you are one that is going to partake in in alcohol in a drink, you want to try and limit that to at least 2 hours before bedtime, making sure you're drinking a couple of glasses of water for every drink. All of this is going to help in how your body responds and reacts to all of this. Then practicing sleep hygiene is also key. Establishing that regular sleep schedule, like we've discussed, creating a comfortable sleep environment, avoiding large meals, caffeine, electronic devices before bedtime can help reduce the risk of sleep apnea. And then also consider a sleep study. If you are one that is experiencing symptoms of sleep apnea, such as snoring or excessive daytime sleepiness, fatigue, or if your bed partner has stated that they've witnessed you waking up, gasping for air, choking in your sleep, consider talking to your provider, your MD, your sleep doctor, your ENT, your dentist, about a sleep study. And this can help diagnose sleep apnea and guide you. They can help guide you towards appropriate treatment options. So it's very important that we understand, by incorporating these lifestyle changes, women can reduce their risk of developing sleep apnea that is caused by sedentary behavior. Prioritizing physical activity, maintaining that healthy weight, being very cognizant of what it is that we're putting into our bodies, adopting good and healthy sleep habits can help improve overall health as well as quality of life. Now, as always, if you suspect that you have sleep apnea, if you have a loved one that is suffering from sleep apnea, don't wait. Speak to your healthcare provider, speak to your MD, call and make an appointment, have a conversation with your dentist, and get the help that you need, because oxygen is important, right? Kind of important. Airway truly is life, and we want to make sure that we are giving our bodies the best chance and the best opportunity to rest, heal, recover, rejuvenate when we are asleep. As always, share this episode It is a pleasure connecting with you all, and I will see you next time.